Welcome to week 8, patterning the hip hinge. So a patient may come to your clinic presenting with a dysfunctional toe touch pattern where they cannot touch their toes because they're lacking a posterior weight shift, or they may be lacking integrity within a straight leg raise, as you'd see in the FMS, which is score of 1. So we're going to work on increasing that mobility and also patterning that with strength conditioning. So the first exercise is an active isolated hamstring mobility exercise to work on the consegrity and mobility of the posterior chain. Have the patient place his hand behind their knee, breathing into the nose. On the exhale, we extend that leg as high as you can. Breathe it back in. Exhale and out. I have the patient perform 2 to 5 sets on each leg. The next exercise is an active leg raise. This is a great exercise for patients that are lacking anterior core control and motor control. What you're going to do is you're going to pull your arms down. That activates the anterior core. Bring my leg up nice and high. Come back down. Hands come up. Back down. Alternate legs. Every time I'm disengaging the anterior core. Between repetitions, pulling on down, coming back up. The next exercise is the quadruped rocking. This works on the patient getting a posterior weight shift and getting anterior core pre-activation of the core. Patients on their hands and knees, and they just sit their butt back into the ball, feel the anterior core kick on, we let go. We press back, hold for 5 seconds, and let go. Press back, hold for 5 seconds, and let go. Your patient will perform about 10 repetitions. The next exercise is the kettlebell sit to stand. So the patient's going to assume a tall kneeling position. They're going to sit back on their heels, grab the kettlebell, breathe into the nose. On the exhale, they come on up, squeeze those glutes, breathe back in, sit back down. This is working on a posterior weight shift as well as the hip extension. Next is the toe touch progression. You take a foam roller, place it between your knees. It's creates a little pelvic floor pre-activation. Patient reaches up, breathe into the nose. On the exhale, they'll reach for their ankles. Sitting their butt back. Reach on up on the inhale. Exhale on out. The board allows for the patient to perform a posterior weight shift. Next, they'll stand here, having the toes on the plank. They reach up, they breathe on out, breathe in, breathe out. Finally, the patient goes feet flat on the floor, they breathe in, and they breathe out. The idea is to continue to progress that posterior weight shift. The next progression is the standing hip hinge with the cook bar. You grab the bar behind your back, and using the assistance, sit those hips back and stand on up. Sit those hips back to work on that posterior weight shift. Stand on up to work on the hip extension. Sit the hips back and stand on up. Patient perform 10 repetitions. The next up is the pattern assisted RDL. Have a cook band around your waist or any type of resistance band. This will allow to help the patient into posterior weight shift. Start with the kettlebell between your feet. Hips go back. Posterior weight shift. Extend those hips on the way up. Sit those hips back. Back up. Working on that hip hinge. The patient would perform 10 to 15 repetitions. The next exercise is the Kaiser pull through. You can use this with any type of pulley system. This is a great exercise prior to the kettlebell swing, so it helps pattern that hip hinge backwards. It's very similar to a kettlebell swing. Sit those hips back, explosively drive the hips forward. Hips back, explode forward. Hips back, explode forward. Next will be the kettlebell swing. The final exercise is going to be a double arm kettlebell swing. Then I'll progress to a single arm kettlebell swing. The single arm kettlebell swing creates a rotational aspect to it, so it's a great anti-rotation exercise. We'll do 5 reps with the double arm and 5 reps with the single arm. Hike the bell back. Single arm swing.